something.
Computers are great when they work. Good morning. I am Michael Perry. If you're a member of the Redwood Empire Dental Society, you probably already know me. I've been a member of this dental society since 1988. I am a dentist. I've been a dentist for 40 years. I was a practice owner for 35 years, and I've taken a particular interest in practice management for the last 20 years. I started a consultancy in 1999 and am still engaged in practice management consulting today. I am excited about talking to all of you today because we are at a very interesting time and unfortunately a very stressful time for all of us in dentistry, if not all of us in the world. But this issue of reopening of dental practices has become confusing. Information has been changing almost daily. I only completed the slide portion of this presentation yesterday. There was new information that I gathered from our trustee here at REDS, Dr. Richard Graham. Dr. Graham and I spoke for over an hour on Friday afternoon after he attended a Board of Trustees meeting at CDA. And so some of the information that I'm going to share with you is quite new. First of all, I think in the age of the internet, we are able to get access to information very quickly, but unfortunately, around the issue of COVID-19 and specifically how it applies to dentistry, the credibility of the sources vary a lot. And so I've centered my research, and the only sources I'm going to say that for me are completely credible. It's the American Dental Association, the California Dental Association, and the Center for Disease Control. It's not that other sources couldn't provide helpful information, but those are the ones that I trust the most, and so except for unusual bits of information, I'm trusting those three sources almost exclusively. Our agenda for today is it's going to be important that we differentiate what we know from what we don't know. And at this point, there is an awful lot that we don't know. We will spend some time talking about PPE. I've defined that section of the lecture as the PPE roadblock because so much of what we know we need to get, most of us have researched what we're going to need to get, but we can't get it. And I'm going to talk about why that is, and it'll be speculative, but we certainly need to have PPE in the reopening discussion. There is the issue of how our employees are getting along, and maybe more importantly to this lecture, how are they going to feel about coming back to work? And what incentives do they have to come back to work, and what is working incentive-wise against them coming back to work? How to communicate with patients. I have spoken with numerous dentists in the last couple of weeks that are using a whole variety of methods to communicate with patients, and I have my opinions about dentistry being a relationship-based service business. And my feeling is there's a right way to communicate with patients at this point, and there will be a right way to communicate with patients once we've decided that we are going to return to routine services. And then some on the obtaining of financing for those many dentists that need help with outside financing in order to get their practices going again. I'll just provide a brief summary of that. So what do we know? What do we know for sure? We know that Governor Newsom has declared a shelter-in-place order. And we, like all other citizens, are compelled to follow the guidelines of the shelter-in-place order. We, as professionals, don't have a special status where we're able to violate those guidelines. In addition, some individual counties, certainly Sonoma County for a while, had guidelines that were more strict than what existed with the general guidelines for California. And if you read the newspapers, those guidelines have been in flux, but the the county guidelines have to, at a minimum, meet all of the state guidelines. So we know that that's true. We know that testing for COVID-19, and I'm dividing testing into two categories. One is, do you have the infection? And the other is, do you have antibodies for the infection? Those two types of testing are available. The testing for COVID-19 has become available to dentists. You probably saw that in your Dental Society announcement that was online. But the credibility of those tests is in question, so I'm going to talk some about that. Unfortunately, the list of what we know we don't know is longer. We don't know at this point when we can return to routine care, and that's the primary focus of what I'm going to talk about this morning. We don't know how employees are going to behave when we announce to them that we are returning to routine care at a particular point. How are they going to react to that? We don't know how patients are going to behave. Our patients, in one way of thinking, are our customers, and they are stressed just like we are about the pandemic. Some of them are going to be very concerned about safety issues, and we don't know at this point how they're going to behave. Some of them are going to want to come in as soon as possible and receive services from us. Others are going to choose to delay services, and that may be because they're fearful for their health and safety. It may be because they have been financially traumatized and don't choose to spend money on our services at this point. There's been a lot of speculation about how patients are going to behave, but we won't actually know that until we reopen for routine services. On-site testing for COVID-19, I will talk a little bit about that, but I'll say at this point that on-site testing is something that would be an ideal, but it certainly isn't available at this point. Probably the biggest unanswered question, the biggest gap in our knowledge that will help us decide when we are going to reopen for routine services is the availability of PPE. I had a chance to speak with Dr. Graham about that. He had just gotten an update from leadership at CDA, and so I'll share what I learned from him about that. We do not know when the governor will lift the shelter-in-place order. When you take your quiz later, there's a question on there about when will the shelter-in-place order be lifted, and the answer to that question should be when the governor says so. And then what's the new normal going to be for the dental marketplace? We were operating in what I've liked to call for a long time a dental marketplace, and it had its challenges even before the pandemic started, and the pandemic is going to, in my opinion, create a very new dental marketplace, particularly for those who own private practices. And I will talk some about that, but I want this lecture to be mostly a focus on reopening. So I'm not going to spend a lot of time today speculating about decisions that we need to make after we reopen. I don't have anything in the curriculum about billing of insurance. I'm not going to speculate about what is going to occur economically. I am a dentist who practiced for a long time. I'm a dentist who's very interested in practice management, but I'm not a lawyer, and I'm not an epidemiologist, and I'm not an economist. So my feeling is that the amount of information that we have about long-term market-based decisions is so scant right now that we need to focus on returning to routine services, and we'll adjust to what the market is doing when we have more information. So I put this in yesterday as I was completing this slide deck because the question became apparent to me. It was a question I had in my own mind. Is the reopening of dental practice, is that actually a misstatement? Is that the wrong question? And in the next few slides, I'm going to answer that for you, at least in terms of how I'm thinking about it today. First of all, as I mentioned in the introduction, we have this shelter-in-place order. Governor Newsom has said everyone is required to stay at home except to get food, care for a relative or friend, get necessary health care, or go to an essential job. If you go out, keep at least 6 feet of distance. So this is the executive order, and you could say that this is a legal requirement. What is interesting, though, is that dentistry is a necessary health care. Now, you could have discussions among dentists about what is an immediate need and what could be put off, but dentistry is a necessary health care. It has always been a necessary health care. And therefore, dentists and their staff provide an essential service. Dentists have not been restricted as service providers, as healthcare providers, from providing service. Their services have been deemed essential since the very beginning. And so I think that's a point of confusion. I think there are some in dentistry that have a sense that they would be committing an illegal act if they went into their dental office and provided services. It's just like the people that are working at Safeway. People that are working at Safeway are providing an essential service. If you're providing care in your dental office, you're providing an essential service. It's not as simple as that, though. The ADA, in a document that they put out about a month ago, more than a month ago, created ethical guidelines. So ethical guidelines are not legal requirements. They are guidelines. They are just that. And you could say over time they might establish a standard of care. I, as a professional, except under very rare circumstances, go against the ethical guidelines that have been created by organized dentistry. I am very loyal in a professional sense to organized dentistry, and so I certainly would not want to imply that I think it's okay for dentists to violate ADA's ethical guidelines. But it's different than the shelter-in-place order. Ethical guidelines are a different thing than your legal requirement to shelter in place. And so please don't try to read this document on your screen. I'm not going to give you time to do that. I just want you to know that it exists on the ADA website. This came out at the end of March, so this is many weeks old. And it's basically a document that when you dive into it, it's multiple pages, is going to help you understand what these ethical guidelines are. This document, which is also available on the website, helps you understand how different dental services are categorized ethically. And I think we've known all along that we could provide emergency services, and most practicing dentists at one time or another in the last 5, 6, 7 weeks have provided emergency services. Those are defined in the upper left-hand portion of the document. And then there's a big section on the right top part of the document which talks about urgent services. And so certainly many dentists along the way have been providing what they consider to be urgent services. What we really want to know is what is in the bottom left. When can we return to routine services, preventive services, and basic restorative services and the like? Surgical services that can be timed much more loosely, that are not urgent care based. That's what we need to know. So the ADA has done a good job of organizing that, and those ideas have not changed in over a month. Having said that, these are guidelines. They are not the same as the shelter-in-place order. They're not legal requirements. You, as a professional, have the ability and are licensed to make decisions about what is right for your patients. So very important to have that clear in your mind. The other issue that is an open question, and we would love to have more data on testing, is do we have some kind of obligation to test ourselves, to test our staff, to test our patients? The unfortunate truth is that the testing regimens that are available in the world today are very isolated. And I had trouble when I researched this online. I found what's on your screen now, that in the United Arab Emirates, the Emirates Airlines actually tests all of their passengers before they go on the plane. And they have the technology that allows them to know within 10 minutes whether somebody going on the plane is infected or not. I wasn't able to find how costly or cumbersome that technology is, but the fact that it exists and that Emirates has been doing this since April the 15th tells me that the technology is available. How feasible is it to take that into dental offices so you could test a dental patient? Or back up, so you could test your staff every morning 10 minutes before they come in and start work? Or test your patients before you see them each time so you know whether you're treating somebody who has the infection? That would be wonderful. That would be extremely helpful. But I think it's important to know that the technology is being used on a very limited basis. And so if it's been done before, it's probably possible. And I think right now testing is an open question. It's not in the guidelines that the ADA has put out, that patients must be tested before they come in, or that we have to have a certain level of testing before we could return to routine services. As I stated in the introduction, personal protective equipment, PPE, is the biggest barrier that we're facing, biggest roadblock that we're facing, in my opinion, in the return to routine services. Most of us have done the research. Most of us are aware of the PPE that's necessary. The ADA and the CDA have supplied very good information about that. I'll talk about that in just a few minutes. But we're not sure that we can get what we need. When I talked to Dr. Graham on Friday, coming out of his Board of Trustees meeting, he, in that meeting, had a presentation from leadership at TDSC, the Dentist Supply Company, and credible PPE, meaning PPE that is going to do what it's supposed to do, that has been properly manufactured and that is safe, is largely being procured by the federal government today. So if you have a particular source, if the surgeon down the hall has some extra N95 masks that you can get a hold of, wonderful, But for most of us, we are not going to have the PPE necessary to return to routine services, at least tomorrow. Are we going to have it on Monday? Are we going to have it in the next few weeks? No one can say. But my feeling is that your dental society, through TDSC, are going to eventually be able to obtain what you need and what dentists need to return to routine services. And in my opinion, once you have that PPE, if you've properly prepared your staff and your protocol in your office, you're going to be ready to return. So to me, this issue of PPE and getting a reliable supply of credible equipment is the biggest roadblock in the process. I choose to be optimistic about that. I choose to be optimistic that if not my dental society, then the supply companies, Henry Schein or Patterson, will be able to get us supplies that we can trust and that we can believe in. So with all that background, with the knowledge that you have not been ordered by some legal entity not to practice dentistry, but you do have ethical guidelines that organized dentistry has provided for you, and that there is some kind of testing that we can do, not specific to COVID-19, but we can look for symptoms in certain ways so we can approach patient care in that manner. What do we need to do now to be ready? It is not a good use of our time this morning for me to review all of the specific technical information that's available through the American Dental Association. About a week ago, this Return to Work Interim Guidance Toolkit came from the ADA. To me, it is the most important document for you to study. I've studied it myself. It's 17 pages long. It's very thorough, and it gives you a wonderful cookbook for reopening your dental practice. It includes communication with patients, although I do want to say that we want to be careful not to use letters and emails as our relationship building tools with our patients. I think a letter like the one that is in the toolkit is very effective at giving patients general information about safety, to let them know that you have done what you need to do and that they can feel safe when they come into your office. Great general information. But when we're talking about rescheduling patients and communicating to them about treatment and appointments, that needs to be handled a different way, and I'll talk about that. The screening process, what do you need to do with employees and patients before they come into the work setting, patients before they come into your office? How do you handle the reception area in order to meet the shelter-in-place rules, the 6 feet of spacing that you're required to deal with? What are you going to do to prepare your treatment rooms, and what protection strategies that go with the PPE? You have the physical equipment, but how do you use it in such a way where you can have optimum safety for employees and patients? I feel that I should say at this point that the reality is, based upon what I as a science understand from my own studies, is that it is unlikely that we are going to be able to get anywhere near a guarantee of safety for patients or employees until we have a vaccine, or perhaps herd immunity, however that's going to look, if it ever occurs. And so this is not a strategy. The ADA toolkit is not a strategy for guaranteeing safety for everyone. It's to create optimum safety based upon what's available and have a reasonable balance between the health needs of our patients. We need to be able to see our patients. They need services, they need treatment and other services from us. And so how can we do that with optimum safety? But it's not complete safety. We are going to be practicing for a time in an era of relative safety. And we want to get that at the highest level that we can. But we're going to all, as individual dentists, have to reach a point where we feel the relative safety is adequate for us to return to routine services. In addition to the ADA toolkit, just last Friday, I got an email as a CDA member. All of you got this email as well. This is the CDA's return to routine services packet. It's more specific to California than the ADA toolkit. My advice is start with the ADA toolkit, study it, learn it, get it well organized in your mind, and then go to the CDA practice resources. They, as I said, have some specific issues for California, particularly some of the human resource issues that you're going to face. I think the two together give you all that you need technically to return to routine services. Let's switch over to the issue of employees. I have, through the School of Hard Knocks, as I said, I was a practice owner for 35 years. I had wonderful experiences with employees. I had so many great people work for me over the years. But like many of you, I had my problems. And at times I was naive about the legality of some of the things that I was doing. And so I had a couple of legal problems over many, many years. And so some of the lessons I had to learn the hard way. But the overriding lesson that I learned is I need to take really great care of my employees. They need to know that I care about them. They need to know that I'm very sincerely concerned about their welfare. And so if I have to default to the legal guidelines, you know, what are my rights and their rights, I'm not in a comfortable place. That's not a place where I feel that I want to be relationship-wise with my staff. So what I'm going to advocate this morning is largely about checking in with your staff before you start to initiate any plan for return to normal care. We have to check in with the staff. They're going through the pandemic as we are, and they may have different feelings about returning to work. They may have different feelings about safety than the feelings that we have. So until we know how they feel about returning to work and their willingness to return to work on whatever conditions they may have in their mind, we can't put together any other plan. So this bulleted list is, I think, very important. And first of all, I think every dentist, I'm assuming that you have the skill set to have a one-on-one, very transparent conversation with each staff member. I don't think this is a group meeting type of communication. I think it's an individual communication. And so we need to, it's probably going to be on the telephone, but if you want to sit in your reception area 6 feet apart with masks on, you could do it that way. But you need to know, you need to tell them that you have an intention of reopening and returning to routine care at a certain point. Now, when you have the conversation, you may not have the ability to say to them, I'm going to start on a specific date. But you can say to them, as soon as you have adequate PPE, and as soon as you feel that the relative safety is at the right point, you are going to reopen. At least estimate the date for them if you haven't decided on a specific date, and ask them what is their intention. they may be furloughed, they may be on unemployment, they may be caring for a family member. They are going to, however, even with all of those things, need to tell you, are they going to start when you start? I'll talk a little bit more about starting in a minute. Starting is actually 2 steps. One is what I call a soft launch, which is getting your team together and putting together your patient care protocol, all the way from making the appointment to the patient coming to the office, going through treatment, and leaving the appointment at the end. You've had a de facto protocol for that for years, and that's going to change, and it may be changed forever. It's certainly going to be changed at least for many, many months. And so that soft launch is you getting your team ready to do that really well. And then you're going to have the actual day when patients return to the office for routine care, and those are the dates that each employee needs to weigh, and they need to be able to tell you, are they going to be in the office participating with the rest of the team on those dates. If you have somebody that says, well, I'm just not sure, I have to think about this, that's okay, but you then need to give them a date where they have to give you an up or down. You have to have adequate notice on which team members are going to be involved in your reopening, or you can't set up the systems. So it's not okay for an employee to say, well, I'll just have to see how I feel about it at the time. It would be impossible for you to plan your protocol without knowing which of your regular team members are going to be part of the process. If you have had issues of trust with particular team members, if your relationship with them has been strained in some way, and my dad always used to say it takes 2 to tango. Usually if there's a trust issue, usually it's coming from both sides. But if that trust issue exists, that may come to the fore. It may be tested at that particular moment. Because if the employee doesn't trust that you're telling them the truth, and the employee doesn't trust that you are truly concerned about their welfare, you are going to be perhaps challenged with what you want to do. And it's going to be harder for you to get a transparent communication, a transparent give and take with that employee. Legal leverage, I'm not an attorney, so I have very little ability to talk about legal leverage. I do know that employees that are on unemployment, if they're offered employment and they refuse to take employment, then in some measure they lose their unemployment benefits. So I guess you could call that legal leverage. But my advice is don't go there. Don't have that conversation. That's a consequence that they're going to have to face as an individual. It isn't going to help you to try to pressure them in any way. Okay, let's switch over to scheduling of patients. I've put out a couple of blogs in the last 2 weeks where I've talked about this issue, so for some of you this may be somewhat of a review, but my feeling is that your patients have been traumatized. They are thinking about you, perhaps. They're thinking about dental appointments, perhaps, but they're thinking about a lot more than you and the dental services that you provide for them. And in order for them to make a decision to return to you for routine service, many of them are going to have to go through a thought process and are going to have to weigh some emotions. Dentistry is a very intimate business. Dentistry, in my opinion, and in my experience, is very relationship-based. And if you're going to use texts or emails or snail mail as your primary methods of communication, I think you're going to have a lot harder time getting your patients to return to your routine care scheme. I think it's very important as much as possible to speak with them live. And when you are going to speak with them, the opportunity to speak with them is going to be when you're calling them about an appointment. And whoever calls them about an appointment needs to be highly trained in the safety protocols that you've put in place in your office. That individual needs to be able to very smoothly and comfortably and with confidence communicate to these patients about what you're doing to keep them as safe as possible. This is no time to fumble over it or say that you have uncertainty. This is no time to say, I'm just calling about your appointment. I don't have any knowledge of what the doctor's going to be doing in the back. So as part of this soft launch that I alluded to earlier, it's going to be very important that the team is properly trained to communicate directly with patients. You have a whole bunch of patients that wanted to get in, or at least were scheduled for services in late March and all the way through April. And none of those people were able to get in. And then you have patients that are scheduled maybe next week, or certainly into May, during periods of time when you are uncertain that you will be offering routine services. For most of you, looking at next week, starting with May the 11th, most of you are not going to be offering routine services on May the 11th. And so I think it's safe at this point to communicate with those patients. And what you've perhaps been doing is having your scheduling person call patients and reschedule their appointments. And when that was done in early April, they may have been rescheduled into May. And now they're going to have to be called again and rescheduled into some indefinite time in the future. I'm advising a different methodology. Those patients that have upcoming appointments where you realize that the probability is very high that you will not have returned to routine services, I would call those patients and have the scheduler communicate that the office will not be open for services and that they will be rescheduled, but I would take those patients and put them onto a very well-organized call list. Now, in the old days in my office, we had the yellow pad, and we would mark somebody who needs an appointment and maybe what they needed to have done, and then when we called them and they reappointed, we would just scribble through their name. We need something much more organized than that, because you're going to have a large volume of patients. They're going to be having a whole variety of different services. Many of the services will, of course, be recall, but restorative services as well. There may even be issues with financial arrangements. When you return to routine services, you're going to need to be as productive as you feasibly can, which means balancing the higher production procedures with the lower production procedures. So this spreadsheet needs to be set up in such a way where whoever's managing the schedule, once you know your date of return, is going to be able to efficiently look for names, look for levels of production, fit them with providers, and put it all back together. So my preference is if you're going to tell people that you're not open for service on the day that they're scheduled, to not just immediately reschedule them at some time in the future. I think you're much better off putting them onto a well-organized call list. Once you have reached a point where you've decided you're in your soft launch, so you know your date of reopening, now you are going to 2 to 3 weeks before that date of reopening. I think 2 weeks is a minimum. You're then going to have your scheduler call all of those patients that are already in the schedule. And the scheduler is going to say to them, calling to confirm your appointment on May the 18th. And the patient is going to say, yes, I have it on my calendar, I'll be there. Or they might say, gosh, I had forgotten about that. Do you think it's going to be safe for me to come in and get that done? And that's why the scheduler needs to be very well versed in practice in laying out in layperson's terms what you're doing for your safety protocol. And some of those people, after that speech, will say, yes, I'll be there. Some of them will decide that they feel uncomfortable. And then you're going to have some that have already decided that it's not going to be appropriate for me to go to the dentist on May the 18th. Some of them are going to say, it's not safe. It's not important enough for me to go in. Some of them have been financially traumatized, and they're going to say, gosh, I just don't have that in the budget right now. So that week of return, you're going to have a certain number of patients that fall out of the schedule. And as they fall out of the schedule, they go over to that very well-organized call list. And so you're going to have these gaps that first week you're coming back. Now you have all of those people that were scheduled in late March and in April that you can now use to backfill that first week. And you're going to go through this process 2 to 3 weeks in advance as you move forward with the schedule, week after week after week after week. So I think it's very, very important that you are seen as a well-organized, well-spoken professional office, and your opportunity to do that is when you're calling patients about their appointments. Okay, emergency financing has been amazingly confusing. And I don't think the loan products themselves have been particularly confusing, but if you followed the drama in the legislature and you followed all of our politicians, some of whom you like and some of whom you don't like, depending upon your political affiliations, they have thrown a huge amount of money at the economy. And I think economists for decades will probably be speculating about what was done right and what wasn't done right. But all this money was thrown out into the economy, and it was put into a pipeline that could only take so much information at a time. And so we have these basic products that you see on the screen. You have the EIDL, which was something that was managed by the SBA, the Small Business Administration. And so this was borrowing money directly from the federal government. You would go on the SBA website, you would click on the CARES Act, and it would take you into an application process, and the amount of money that you could borrow was not clearly defined in the application. I run a practice management consultancy today. I have no employees. I am the only employee. And so I went on and applied for an EIDL loan for my consultancy. The amount that would be forgiven, and forgiven really means that that portion of the money is a grant, it's not a loan. It's money that you're given by the government that you don't have to pay back. And it's stated very clearly when I did this, it's probably before April the 1st, that $10,000 would be immediately put into my business account and that that amount would be forgiven. Well, later on, when I got a response, weeks later, the rule had changed to you will be forgiven for $1,000 per employee. I have 0 employees, so I was going to have none of it forgiven. And still to this day, I have not had communication from the SBA about how much they will let me borrow for my business. So it's a wonderful program, it's a wonderful idea, it's wonderful for dentists to get this money and to have a certain amount of it be forgiven. But I have talked with many dentists who applied for this loan. There are a minority that have gotten this money, but there are many that have not. The Paycheck Protection Program, the PPP program, is also SBA, but the application process is through a bank. So for most of you who already have a banking relationship with your practice, you would apply through your bank, assuming that they were SBA affiliated. So the application is a bank application. It's not a federal government application. And the amount of money that you could borrow was specifically defined in this case. It was 2 months of payroll plus 25%. So you could say, well, that's 2.5 months of payroll. And the forgiveness guidelines were very well delineated. As long as 75% of what you borrowed through the PPP program was payroll, that is going to be eligible for forgiveness, and then there are some other things that you could use the money on as well. I have been told, I listened to a webinar that Ali Aramshian, he's a friend of mine that I work with very commonly, and he's endorsed by CDA, put on a very good webinar where he talked about this particular loan program. And he warned all of us that the promissory note that you're going to sign is with your bank. And the forgiveness rules and the other rules that go along with the loan will be the bank's rules, not necessarily the federal government's rules. So be very careful to look at your promissory note, and if you're counting on forgiveness, if you do get this loan, you will need to follow your bank's rules, and they may not be as defined by the federal government when you look at the CARES Act website. I have heard from a couple of dentists this week that they have now gotten that money. If you have not applied for an EIDL or a PPP, unless you have enough savings to where you don't need these extra funds, I would apply for them. It's a good business decision. Even if you feel like you might have enough savings on your own to be okay, since a certain amount of this money would be forgiven, it's actually a grant from the government, it is going to help you pay your employees during your re-entry into practice. When you re-enter practice and you're initiating these new protocols, you're going to have inefficiency. You're not going to be as productive as you normally would. Things that used to take small amounts of time are going to take larger amounts of time. So I think it's important that you are well capitalized and that you take advantage of these loans. Having said that, I attempted to go on my bank's website. I work with Exchange Bank here in Santa Rosa, and I attempted to go on their website, and their communication is that their portal from the bank to the SBA is just completely overloaded. They're not able to take any more applications. So at least through Exchange Bank, I'm not able to apply for a PPP loan. And I think the other local dentists that work with them are in the same situation. So I'm told that that you may be better off searching other banks. But I do think it is well worth your time to apply for both of these loans, if for no other reason than you have a good chance of a certain amount of the money being forgiven. Just so I don't miss the point, on the EIDL loan, if you have 10 employees and you get the funding, you will still have the $10,000 of forgiveness, 10 or more employees. If you have less than 10 employees, right now the rule states $1,000 of forgiveness per employee. And I know the California Dental Association a while ago urged us to write letters to our legislators urging them to rescind that rule, that every small business, regardless of the number of employees they have, should get the $10,000 of forgiveness, because the average dental office doesn't have 10 employees. But my understanding, the way that it sits right now, is that the forgiveness for the EIDL is $1,000 per employee. Delta Dental has a program that they announced through Lendeaver, which is an online finance company. They will loan up to 15% of your 2019 collections, and that caps out at $200,000. But there's no loan forgiveness program there. It's really just borrowing money. So if you are going to borrow money through any of these programs or borrow money from your bank in order to get working capital to get your practice going again, I'm not sure that the Delta program is probably the best one to choose. I have only been able to research it online. I don't have specific information beyond that, but I would certainly choose the EIDL or the PPP through your local bank before I would look at the Delta Dental option. This whole change, this pandemic that's affected all of us in the world, and specifically those of us that work in dentistry, has been traumatic for everybody. Everybody has been traumatized. Everybody has, or at least many have, heightened levels of stress. And I think it's going to be very important that dentists who own practices, who are engaging in the process of reopening, engaging in the process of returning to routine services, have a strong sense of leadership. We are going to need to know what we're doing. We're going to need to be able to assure our patients and our staff that we are doing all we can to keep them safe and that we're acting in their interest. And so even though we owners are stressed and we have our own emotions that we're dealing with, we need to be prepared to lead. I think in addition to that, I think dentistry has been well known for its collegiality and for the camaraderie and the professionalism. That's been there all the years I've been in dentistry. It's something that my father, who was a dentist, often talked about. When I first came to Santa Rosa and was accepted into the Redwood Empire Dental Society, it was like coming into a family. And I feel that here at Reds, we take care of each other. I feel that that's the philosophy that exists at the state level as well. This issue of PPE is not an issue of going out and finding toilet paper. This is an issue of getting protective supplies for the profession in general. There are going to be some young dentists that are going to need the help and advice of more experienced dentists. So this is not a time to hoard things and not a time to just look out for ourselves. This is a time for us to come together and help each other. I think it's very important for patients that we all do that, but I think it's very important for the continued health of our profession. Quick review. Our next steps are we need to be sure that we have the ADA toolkit and that we have the CDA Back to Work resource guide. Those are the cookbooks that we need to be sure that we have taken care of all of the details, at least as they're known today. We need to have those one-on-ones with our employees. We need to talk to each employee. We need to do it in a trustful and transparent way, and that we need to make it clear to them that we are genuinely concerned about their safety and welfare, but that we must know what their intentions are. We are going to watch like hawks for PPE availability. I think that's an easy one for all of us. Different dentists have different sources. I do think that it's very important that you be careful about your source. There are a number of anecdotes floating out there about dentists that have been taken advantage of and counterfeit products and other out-and-out scams around PPE. So we want to be sure that we're getting the right stuff, and I think the most reliable sources are Well, to me, the most reliable source, of course, is TDSC. But we want to be sure that we're not using some obscure source that we're not sure is safe. We need to initiate the protocol that I outlined about communicating with patients. So we're going to use the scheduling framework to handle the greater communication about patient safety. And we want to be very organized in how we reschedule patients, not only because we have to just put them into spots, but we also need to be productive as soon as we feasibly can. In order to do that, we are going to have to set up a soft launch. So at some point, we are going to have to make a decision that, at least tentatively, we are going to return to routine care on a specific date. And at this point, we're sitting here on May the 4th. That's very hard to know. My educated guess is that as we move through the month, it's going to become much more apparent, in particular when we have a better sense of how to obtain PPE. As I said in the introduction, I was going to stay away today from longer-term practice management issues, such as claims filing, fees for PPE, other practice management issues. Perhaps there'll be a time for me to do a future webinar on those issues, but I think those things could be a distraction at this point. I think it's really important that we return to routine care with great leadership and efficiency, implementing the things that I've talked about so far. Those issues about, is Delta Dental going to give us some money for PPE, or should we charge patients more for PPE, and how much more time is it going to take to do a Class 2 composite under current circumstances? Those are things that we will come to know very quickly, and I would be happy to return and talk about those things when we get to that point. My contact information is on the screen if any of you need to reach me and talk with me directly. Martin is going to supply me with some questions that have come in. It is now noon. I don't have a hard stop today until 12:30. I can't imagine that Q&A will go that long, but let's go with questions as best we can. Let us address the personal question that as dentists, most of us in a dangerously susceptible demographic as well as environment do not feel safe going back to work. How do you address this? The ADA guidelines is a nice document, but does not give any definitive steps to follow. We know too little of host response as well as the nature and mechanism of the infectious agent to address this rigorously. Also, the legal liability is a big concern. We need the ADA to give legal clearance or guidance. So there were several questions in that one. And I feel I should preface my answers to the questions by saying I'm not an epidemiologist and I'm not an attorney. To answer the last part first, I have read in the news, as maybe some of you have, that the legislature is considering providing liability protection for healthcare providers. So there's some discussion about that. To my knowledge, there hasn't been anything specifically decided, and my feeling is that if you are in alignment with the ethical guidelines provided by the ADA, that is close or perhaps at the standard of care that we have at this particular point. So my feeling is that if you feel like it is too risky for you to be in business because an employee or a patient might say that they contracted COVID-19 in your dental office, then you shouldn't go back to work. But I don't think we are going to be able to have that level, that high level of safety with certainty for a long time, for many, many months. If it takes us a year to get a vaccine, then that's how long it's going to take to get to that level of safety. So my feeling is that you need to follow the ethical guidelines. To me, they are the right thing to do anyway, and if there are legal risks inherent in that, then as a business owner, you have to take on those risks. The earlier part of the question, which was largely about physical safety, I think, of the dentist, I think that's what the doctor was asking, is if I'm in a demographic where there's risk, if I myself, I'm 67 years old, so I think I'm right in the heart of that risk group. If I'm also immunocompromised or I have some other medical predisposition, I'm going to have to take that into consideration when I decide to go back into practice or not. Those risks are inherent in everything that we do. I think there are people in the population that are more at risk. I think dentists are educated enough to know what category they're in, and they have to make that decision on an individual basis.
I have a question as to, you said not to send letters to patients. Why?
Actually, Martin asked me the question, it just came in. I said to not send letters to patients. Why? I think that may have been a misreading of what I said. The letter that is in the ADA toolkit, I think it's fine to send that letter. What I don't want is to use letters as primary means of communication. A letter is a good thing to help your general patient population understand what you're doing in terms of the safety protocol. What are you going to do to keep them safe? And to let them know that you are knowledgeable about the subject and that you intend to optimize safety in your dental practice. It's fine. It's like a white sheet going to your patients. What I don't want is to use letters as means of communication about scheduling. And we want the live conversations between trained staff people and patients to also help tap into the feelings that each individual patient is having. Because you're going to have some patients that are almost indifferent to the perceived risks, and you have others that are right on the edge and extremely fearful. And in a relationship-based service business like dental practice, that can only be done individually with patients talking with them live. So I don't have any problem with letters. I just don't want that to be the primary means of communication about scheduling and then safety issues as it relates to scheduling. So what about California Department of Health stating emergency only care? There have been no changes. I'm not a lawyer, but what I'm going to say is up to the individual dentist to decide what is in the patient's interest. You do have a shelter-in-place order from the governor that you have to comply with. But to have somebody at the state of California saying to you, this particular dental procedure is appropriate. It's appropriate to mix up some IRM and put it into a broken tooth, but it's not appropriate to use another restorative material. I'm not a lawyer, but my belief is it's up to the individual dentist to decide what's appropriate for the patient. I think it is very appropriate to use ADA ethical guidelines and information from CDA as an adjunct to your decision-making process, but I don't feel that you are compelled by the California Department of Health to do certain things and not do other things. Another question. Irrespective of the economic ramp up is going to be slow and irregular. This will place severe economic strain on planning and budgeting and will also cause problems with the EDD if you play with your staff hours. There are a couple parts to that question, and I cannot speak to the legal requirements that the EDD may place around staff hours, but I don't think I'm going out on a limb saying that you are running a business, and as the business owner, it is your decision what hours you are going to provide services for patients and what hours employees are going to work, as long as you're not discriminating against them in an illegal way. My feeling is, to the first part of the question, that in the ramp up, you are certainly, your normal routine is certainly going to be disrupted. You are going to need more time with every patient. Martin and I were talking about this at the very beginning, and I stated that the practice that tends to be smaller, but that typically does more work on individual patients in a sitting. If you see 12 patients in a morning doing small procedures, you're going to be much more affected by this change than if you're treating multiple teeth over several hours and only seeing 2 patients in a morning. Because the PPE requirements are per patient. Whether you're doing a 5-minute procedure or a 3-hour procedure, the PPE requirements are largely the same, at least in terms of the equipment that you need to use. And so for issues of time efficiency, if you have a practice where there's a lot of activity and a lot of patients coming and going and a lot of touches between providers and patients, you are going to be very disrupted as you compare to the routine that you had before you went into lockdown. No question about that. My feeling is that the important thing is that once you've decided that the relative safety is there and that you are reasonably well prepared to return to routine services, it's very important that you do that, assuming, respectful of the one doctor's concern about her or his own personal health. If you, as the dentist, are in a high-risk group, you're certainly going to make a decision about returning to routine care than somebody who's young and has no health issues. I think we all know that. But no matter who you are, when you return to your normal routine, it really won't be your normal routine. There's this phrase that's used a lot today, the new normal. What is the new normal going to look like? And how are the other players in the dental marketplace going to adapt to the new normal? I think those issues are going to become evident very quickly after practices return to routine care. When patients start to gain the confidence that it's reasonably safe for them to return for routine dental services. But it's not going to look like it did before. It's going to look somewhat different. And as we have those experiences, we will learn very quickly how we need to adjust our business systems in order to stay healthy economically. Martin, do we have any more questions? So with that, I appreciate everybody's attention. If you need to communicate with me, my information is on the screen. Martin tells me that this lecture will be posted on the Redwood Empire Dental Society homepage if you want to view it again later, or if someone else wants to watch it at a later time. And I wish you all great health, and I hope that the positives that come out of this change start showing themselves soon. I know it's been stressful. I know it's been tough. But I believe strongly that we as a profession, we're going to get there. We're going to be okay. Life's going to be different. And my belief is that now is the time to get yourself ready. This is the time to contemplate what I've talked about. And if anybody has any individual questions about that, you know how to reach me. Thank you very much.